Hello and welcome to this channel. This is Dr. Orora Maranga, consultant gynecologist and a specialist in cancer treatment at Janice Hospital. Today we are going to talk about a very common condition in women, and that is fibroids. What are the symptoms, how common is it, and what's the treatment? We're going to address all that shortly. Now, did you know that actually 1 in 4 African women has a fibroid? You walk on the street, you stop 4 women, 1 of them is likely to have a fibroid. But you have few who actually go on to develop the symptoms. And from statistics, by the time an African woman reaches around the age of 50, almost 7 out of 10 would have had a fibroid during that time of their reproductive age. What are the symptoms? The commonest symptom is there is no symptom. So a woman comes and she has no symptom at all. Maybe she is pregnant, or she has some abdominal pains which may not even be related to the fibroids. When you do a scan and there it is, she has a fibroid. And often patient will be very, very worried about it. And yet, it could not even be causing any problem. So the symptoms would be, when they do have, the symptoms would be bleeding, heavy periods. So you find the period has suddenly become or progressively become very heavy. Instead of maybe the previous 4 or 5 days, it has gone to 7, 8, 10 days. So it gets prolonged. And it gets heavier, so a woman would use more pads as compared to previously. She may start having clots in the menstrual flow, which previously she probably didn't have. And the periods may become very, very heavy. This is not to mean that if you have those symptoms, then definitely you have fibroids, but they are more common with those symptoms. And for others, they can actually become very, very big. A woman may feel as if she's pregnant, and even others may start even congratulating her that she's actually pregnant. And yet, it's basically the fibroids which have become bigger. Now, what happens when one has those fibroids? There are various types of fibroids. They could be inside the uterus. They actually arise from the wall of the uterus or the womb. They could grow towards the cavity. They could grow on the muscle, or they could grow towards outside. The ones which grow into the cavity would generally tend to have more symptoms. They could also cause difficulties in conception, so may have delayed conception due to those fibroids. The treatment would depend on the symptoms which the woman may be having. Will also depend on the age of the patient. Will depend on the size of those fibroids and the number of those fibroids, and the desire for fertility. So for others, if they're not so keen on fertility, and a woman is probably around the age of 40 and has a lot of symptoms, then we may remove the fibroids together with the uterus. So a procedure which we call hysterectomy. Or for a younger woman who has a desire to get more children, or would still want to keep her uterus, we can go and we can mainly do the procedure we call myomectomy, which is basically removal of the fibroids while sparing the uterus, therefore meaning that she would be able to conceive and get more children if she ever does desire to do so. The other treatment, which could be more temporarily, is the medication which you give, which could be tablets or it could be injections. But these ones tend to relapse quite a bit. Medically speaking, there are also other injections which we give. We call it uterine artery embolization, where we starve the uterus of the essential blood supply, and therefore it tends to reduce or wither off, and therefore the fibroids also wither off. There are other new technologies which have come to play at the moment, but those are basically the most common of the treatment that we offer when a patient comes to us with fibroids. This has been Dr. Orora Maranga, consultant gynecologist and cancer specialist at Janice Hospital. Remember to subscribe and share with your friends. It may help somebody who is in need of this information. Thank you.